Hello, hello. Welcome to Bot Resources. This is Outpatient OT, so welcome to the group. If you're on YouTube and you are not a part of the group, find us. My name is Michelle. I'm an occupational therapist, and I own occupational therapy. I own the profession. Welcome to my profession. I own Buffalo Occupational Therapy, and this is my other half.
My name is Hannah McDowell. I'm a certified occupational therapy assistant and lead OTA at Buffalo OT.
So, first off, let's just get this out of the way. There is no difference between OT and OTA. We are the same coin, two different sides. We work together as a team. It's not like a OT's up here, OTA's down here. It's not like that. We're the same, right? One person's a treatment specialist, integrative medicine, right? The other person creates the plan, and we both have our things, okay? So one coin, two sides. All right, now to our topic of the day. Our topic of the day is explain your profession. Now, this is a biggie for us. So this is our soapbox, and this is something that we are very passionate about, especially it being OT month. A lot of people are repping their explanations of the profession, but I think we need to revisit how we approach, how we explain it. What do you think?
I apologize first and foremost if this seems like a slightly unhinged live, because it just does something to us, people's explanations of occupational therapy. Yeah, we need to do better as a whole. We do.
So right now there's like this huge problem where OTs aren't getting a lot of referrals, and it's because
nobody understands what we do.
They think we're a joke.
Yeah. That's
a problem. And when we, as a profession, as students of occupational therapy, as new grads or vets in the OT profession, when we are perpetuating the problem and not explaining our competency, but instead leading with very unfortunate explanations, we're actually kind of doing it to ourselves. So we got to correct it. So that's what we're doing today. So we're going to go through a list of terms that you should not use when explaining your profession, okay? You should not use these terms in your elevator pitch. I don't care what academia is telling you. I don't care, because they're not the ones out in the clinical world. Us running a private practice in the medical model, in orthopedic and neurological rehab, we know this on a daily basis, where people need occupational therapy because this profession is freaking brilliant. We are awesome, and we're the solution to so many problems. But because we have this epidemic of occupation, oh my gosh, we say this word so much. This is the first word, right? This is the first word you should not say when explaining occupational therapy. Occupation. People shut down.
Their eyes, you can see it. Their eyes just glaze over, and you've lost them, and they're thinking about how they're going to schedule their sessions for physical therapy.
That is exactly it. If you work in SNF, you already know this to be true, because everybody says, well, I don't really need this. I need physical therapy. Well, what are you doing about that? Because that's a problem. They need you. So what are you saying when you walk in and you're introducing occupational therapy? You don't say, we're going to help you with your occupations. Nobody knows what that means. Nobody knows what an occupation means, and nobody wants to know. Nobody wants to know the definition of an occupation. They're beyond that point in their life. So don't say that. Next one, occupy. An OT helps you do everything that occupies your time. What? What does that mean? What does that mean? I don't know. If I told somebody that, if somebody came up to me needing, they're flaccid, they have a flaccid extremity post CVA, and they would like not to be paralyzed. They would like very much not to be paralyzed. They're going to come to me. They're going to say, well, what can occupational therapy do for me? If I tell them, well, I'm going to help you do everything that occupies your time, That's great. Let me go ahead and schedule my appointment with physical therapy. I don't need you. That's great. I don't need like an enhanced certification program in woo-woo world. I need to actually have rehabilitation. I can provide that, but I'm not telling them that. I'm telling them that I can help them with their occupations or anything that occupies their time. Okay, newsflash, bathing does not occupy their time for 24 hours a day. Cooking, there'll be times where I'm sick. I don't even cook. I go to my applications and I order food to me, so I don't ever have to even pick up anything in my kitchen. That is not where OT lives and dies. We don't live there.
We have this idea when we're new grads and when we're practitioners, and maybe this is just the world of occupational therapy that you've been immersed in, that people's occupations, your occupation is dressing and bathing and feeding. And when using this example as someone with a flaccid upper extremity post whatever neurological infarct, we go right there. But their occupation, what is the most meaningful to them in that present moment and will be for a long, long time, is the use of their upper extremity.
Yes.
So you going in and saying, I'm going to help you with everything that occupies their time, there's a disconnect. Just like between school and the real profession, there's this disconnect in your explanation where they want to hear that I am a functional movement expert. I know principles of neuro re-education. I can help you regain movement in your upper extremity because I am physical medicine. That's what they want to hear. They don't want to hear, we're going to make you put cups in a cupboard. Ugh. No. And if you feel called out, then you should be doing something better. We'll just
lay it down.
We're just going to lay it down.
We'll lay it down because guess what, guys? Check this. Future of occupational therapy right here.
Next gen, cutting edge.
We are cutting edge. Next gen OT. Be better. Be better than this. We don't just do things that occupy their time. Another thing, don't use meaningful activities.
Nobody knows what that means. Nobody knows. We know what occupations are.
Yes.
We understand that. We look at the whole person holistically. That is unique to us. We get that. That's what drives us. We're always looking at the big picture. Always. But nobody understands what meaningful activities are, because most of the time, all of our patients, neuro, ortho, what is meaningful to them is getting better. That's it. What's meaningful to them.
Use terminology that is relevant and palpable, right, to them. They want you to tell them that you are the answer to their issue. If somebody has been post-injury or has been living their life in the community with any number of diagnoses, believe me, I promise, they will find a way to adapt and compensate. They will find that way. They don't need you to tell them how to do that. If someone's coming to you for anything, they want you to look at their problem. They want you to say, this is how we're going to address your problem. We're going to do it together. We're going to look at it based in science and research, right? And we are going to bring your arm back into function to do whatever it is that's meaningful to you. Yes, okay, meaningful there. But see how I led with the arm. See how I led with the functional deficit.
With what they are most concerned with.
Yes. Okay, next one. Abstract cute responses. You don't put the fun in functional. Stop it.
You got a t-shirt with that on it? Throw it out.
Stop it.
Throw it out. Unless like work in pediatrics, and then maybe I can see
That's
a
super
world
fun.
where that would be cute. That would be fun.
That
I
is
also
super
work
cute.
in pediatrics as well. I couldn't, but like I could see a world.
There is a world where that's cute. That is not the whole profession.
No.
It's just not. Okay, move on. Okay. Naked. No, PT does not help you move, and you help them get there.
Make sure we don't do it.
I can't even say it right because I just don't even.
It just infuriates us to the core. You cannot truncate our entire profession to getting dressed. You can't do it. You can't. Don't do it to us. Don't do it to the people who are trying to run an outpatient facility.
We do gait analysis on a daily basis. We do postural analysis. We fix muscle imbalances. We retrain the lower body.
We make sure they have the functional movement patterns in order to cross the midline of their body to their opposite appendage and like put on their clothes or whatever. We do so much more than truncating our profession to making sure that you don't walk naked.
That's bad.
That's not good.
That's no good.
And it doesn't say you have a master's or a doctorate or associates in a rigorous, scientific, medical profession. That doesn't say that. It doesn't. It doesn't say it.
Not only that, but you know what hurts the most is that you are elevating a different profession to be more like you say PT helps you walk, and then you make fun of us. You are making fun of us. You are saying PT helps you be effective with your mobility, and PT is going to do the work, and we're going to make sure you're not naked. Like, why does it have to be a joke? Why does your profession have to be a joke? It's not. It's not a joke. It's not funny that somebody does not have the functional components to be able to dress themselves. And not only that, but it doesn't describe the continuum that it's going to take to ensure that that individual can dress themselves, which is dynamic, which is static to dynamic sitting, which is static to dynamic standing, which is being able to combine all of that into a transitional movement while maintaining the internal components of their body with brain function, right? That basal ganglia that's bringing it all together. We know that information, but when you truncate it to, we're going to make sure you're not naked. They
don't see the like clinical scientific, they don't see us then. They don't see us. All they see is ADLs, and we are so much more than that. And even if you work in a skilled nursing facility, your OT pitch can be like good and really shine a light on our profession. It can be good. So how can we make that better? Because a large percentage of practitioners work in skilled nursing, and maybe this is just the easiest way they found. Maybe it works for them, but how can we advocate for our profession and describe what they're going to work on with individuals in skilled nursing? How can we describe that better?
That's a great segue.
Yeah, it is.
To action steps.
Oh, I didn't even look at that.
See? So how can we describe it better? How can we show everybody, other healthcare professionals, our patients and their carers, right? Those people who are looking from the sideline to see which profession is working with mom, which profession is working with my sister, which profession is present, and what are they doing? What do they know? Everybody wants to be their own doctor, and everybody wants the best care for their loved one. They need to know that you know what's going on. And we spend years in medical classes, science classes. It's not, I mean, we have one class on therapeutic activity where we make baskets and mosaic art. Like, we have one class. The rest of it is really hard.
Neuroanatomy, gross anatomy,
neurophysiology, physiology, physics. We do all of that. What kind of explanation is going to tell the world that they need you? Hannah has some examples that she would like to share.
Oh, wow. Hannah has some examples we'd like to share.
These are really good. And it's a great place to start. This is Hannah describing what she does on a daily basis as an OT. This is OT. This is the next generation of OT.
So a point, and I'm going to give credit where credit's due, Hand Therapy Secrets, Huang Tran. I received her emails, and she had, here are some pointers for describing your profession, and start with what you're doing now. Don't try to explain the whole entire thing. Wait until then they're a patient with you, and you can say, well, yeah, that gain made you feel really good because you were able to do so, and so. And that's what occupational therapists do. They look at you from the whole picture. Don't try to explain a huge, broad profession right off the bat, because you're going to lose that person. What is most relevant to them? How can you help whatever their injury or impairment is? That's what they want to know. They want to know that you know the science. That's what they want to know. And how they want to know that you know the science, the rationale, and what you're going to do. They don't care about our entire profession or that we started after World War II. They don't care. They don't. So these are 3 different descriptions, sentences that I would tailor to whoever I'm talking to describe what I can do on a daily basis, what I do on a daily basis. I help individuals with chronic pain learn how to move correctly and utilize manual techniques such as massage and stretching to decrease their pain and correct imbalances. That's what I do. I'm an occupational therapist. I help individuals diagnosed with neurodegenerative conditions maintain their current level or baseline of function by using motor-based cognitive therapy. I'm an occupational therapist. I help people reintegrate lost movement after a stroke or traumatic brain injury by using specific exercises that enhance the connection between the brain and the muscles. I'm an occupational therapist. How can you describe what you do wherever you are that is led with science? So I help individuals in subacute and long-term care maintain their functional baseline. I help them reintegrate movement post-stroke when they're staying in subacute rehab. I am an occupational therapist. Why does it doesn't have to be truncated to ADLs where people don't see the science. They don't see the science behind that. We know that we're using activity analysis. We know that what we're doing is scientific. We know that we are helping people's lives. We know that. We do. But other people have to know it. Being the first rehab professional, for us to be this far along and still have just this mystification, just this cloud of confusion around us is unacceptable. We have to lead in our explanation of occupational therapy with science, because we're never going to get primary care physicians to start handing out referrals to something that they were like, what does that even mean? I had a conversation with one of my doctors. She came into the room, wasn't even my doctor, was like, I heard that you are a lead therapist at an outpatient clinic. I have a lot of Parkinson's patients. What can you do with them? If I looked at her in the face and said, well, I can make sure that they get their pants on, she would have not sustained a conversation with me. But I told her about our motor-based cognitive therapy, about how we are leading with science and evidence for people diagnosed with Parkinson's. You need to know why you're doing what you're doing with every treatment intervention, and take that same clinical rationale and apply it to your elevator pitches or whatever. People need to know the science behind what we do.
I think that it's important to also know that science is okay. It's okay. We are medical and social science. It's not taboo. You can tell people that you are a medical professional without losing that good feeling of saying, okay, I'm different. I'm not a reductionist therapist. I don't just look at the problem. I see the whole picture. You don't have to use these convoluted explanations to explain that you see the whole picture, because you are grounded in medical and social science. You have to be able to use medical and social science to explain your profession so that you can have a job for a long time and get paid well.
Mm-hmm. So bring people on board with their issue, speak the science, tell them your pitch should be what you are doing in your daily basis. Don't say, oh, well, we could work in mental health, we could work in this, because they're all so different. Like, really, I mean, everything is neuro if you think about it, but each of these areas is so different that you don't have, unless someone is like on a first date with you and being really like, okay, I'm going to sit here and listen. They don't care, and they're not going to listen, and they're going to dismiss you. So make a pitch. Mine were all one sentence long, but I was like, oh, that sounds really cool and like scientific.
Ooh, tell me more.
Like, how do you do that?
Exactly. All right. So that was it for today. Take that, spread the goodwill, right? Tell your friends, and please head back to your elevator pitch. Do a little upkeep. I think that'll be a good job.
We love you all. We love the profession. Take our boisterous explanation of all of this with love. It comes from a place of love and passion. Have a great day.